EMAS has one mission, the promotion of health in midlife in both genders, women and men. We focus on both research and education with a special interest in the young science group. Our journal, Maturitas, has a continuously increasing impact factor, and beyond our biennial congress, we try to publish position statements with clinical guidance in our journal, 2 to 3 per year. We try to be present in every international congress with an EMAS symposium. We also organize a monthly webinar. This is on a regular basis with topics which are interesting to clinicians. Our newsletter is open and read by around 25,000 readers. And furthermore, we have organized recently the Junior Mentorship Program. This is a program to promote the collaboration between the young and the senior scientists. And furthermore, we collaborate with around 45 affiliate societies, and we thank them for their support throughout all these years.
What have I learned since becoming the president and executive director of EMAS? Basically, women's health should be expanded from midlife to long-term health issues. And this is the focus of this conference, looking at a long-term view of women's health.
Well, I always enjoy the EMAS meetings. They provide an opportunity to get together with colleagues, speak with colleagues, not to mention the sessions are always some of the latest information, so it's a meeting I very much enjoy.
The conference in general is extremely good, and it has a wide spectrum of areas because the menopause, as we know, is happening in the elderly population, if I can put it that way, which is a huge factor nowadays in society, particularly as we're all living longer. And the spectrum of areas that it covers is way beyond just hormonal treatments of the menopause, but also areas, which is my area of expertise, is cancers in women as well. So there's a very, very broad spectrum here, which is very welcome, and it's a good forum to undertake that kind of research and present your research at it. So it's excellent in that way. And also, on top of that, I believe the numbers are up. So we're anticipating somewhere around 700 delegates, and I've been told there's 850 delegates. That itself shows you the interest around Europe in this area of medicine.
No, I think that EMAS is covering an area of a very, very great interest and importance, also because in the general gynecological education, not only of the gynecologists, the area of the menopause was absolutely very poorly covered. And the general knowledge about what is the menopause, what are the possible effects, how we have to face, how we have to follow, what are the suggestions to give to the woman, but not only to the woman, or to all the society, they are very poorly known, and the people and also the doctor, they know only what they can find in the daily newspaper, and then this makes the wrong situation now. It was also important to tell that EMAS was facing what coming out from other societies with some criticism since long time, and I was also part of EMAS since long time, and we were an active partner to promote a better knowledge of what we have to do, how we have to treat and to follow the woman, what are the suggestions, and not only the treatment, but mostly the correction of style of living, way of eating, how to move, what to do, what to have the personal care that a woman she have to do, and how a husband or a friend have to understand a woman who is moving to the menopause, because also the men have very poor knowledge what it will happen in our family when the mother, when my wife, she will become menopausal, and then also the children have to understand that something is changing. And EMAS had the great role also to promote real good education concerning the treatment possible. And this treatment, which have been criticized for a lot, more or less 15 years ago, now appear to be really safe, really able to do what to realize what they promise, and then to achieve very good effect, not only for health in particular and for the body, but also for the quality of living, on the perception of staying. And then I think he must have done a very good job. And this conference demonstrated that in a time where the investment in women's health are declining, we have seen here companies, people, new molecules, new discussion, and good talks, and then we come back at home all with more strong in comparison to when we came, and then with the hope that we will be able to help the women and to take care of their quality of life and their health.
So one of innovation that the educational innovation that the EMAS want actually to initiate is the JUMP program. The JUMP program is an exchange between young students, young colleagues all over the Europe. So the whole idea is to make pairs of mentor and mentees. So one mentor of a specific country will be paired with a mentee of another country, and they are going to have an online, let's say, communication and scientific production. So many types of studies can be produced with this. It seems like a win-win situation in the means that it's going to provide actually the scientific collaboration between the center. It's going to increase the collaboration between the mentees and of course with the mentor as well. An advantage for the young colleagues is that if you successfully manage to perform a work in this JUMP program, you will be eligible to have the free registration to the program, and there is a dedicated session actually, so you will be able and to present this in a very prestigious congress as it is the EMAS Congress.
It's a pleasure to be here, and thank you for the invitation. I would like to talk about some of the things that I presented here at this very exciting meeting. I talked about a controversial issue, the issue of removing the ovaries in women at the time of hysterectomy. For many years, it was common to remove the ovaries along with the uterus at the time of an hysterectomy, believing that that was a good idea for the prevention of cancer. And in the last 10-15 years, we have accumulated evidence that that is not a good idea and it should not be done. And I presented yesterday some new breaking news on the fact that the disadvantages of removing the ovaries are way, way bigger than the advantages. And so we concluded that we did recommend continuing the practice. I participated in the past to some of the EMAS meetings. I was at the Madrid one 2 years ago, but I have to congratulate the organizer on the Amsterdam meeting. Excellent place, excellent venue. Big but not too big. I met a lot of old friends and colleagues, and a very, very nice space and place, very good program. So I congratulate very much for the organization of the meeting. Thank you.
Well, I'm very impressed about the amount of attendees at this Congress, and I think even for Dutch standards, because we don't have so many locals who are interested in this topic as menopause, but even for Dutch standards, we have so many attendees and they're all very enthusiastic. They're very enthusiastic about the scientific program. They learn a lot, they network a lot, they make a lot of contacts, and they're really enthusiastic. So I'm very happy that it was possible that we have EMAS Congress, the 11th Congress of Menopause and Andropause. We had it here in Amsterdam.
No, I was very impressed by this Congress. I think in terms of numbers, this is one of the most successful EMAS Congresses ever. And what me impressed most is the fact that here you really feel the interdisciplinary aspects. So we have cardiologists, we have gynecologists, internal endocrinologists, lots of people who are interested in the topics of the other fields. And that makes it so interesting and so special to be here.
The European Menopause Society has been growing a lot recently. It's been a tremendous improvement in the quality of science, in the scientific level of the events we've been organizing. And the society has had the merits, thanks to the previous presidents, to build up a lot in digital information in order to increase the outreach towards people everywhere in the world. This is a very positive situation for the society currently. Many of our members, and actually in the current board also some board members come from outside Europe, and I believe this is really the sign of the relevance of the society and of the importance of the society for the people. So for the next few years we need to continue to follow this path. It is my firm belief that increasing educational efforts to bring information which are both scientifically sound and practical, so useful for clinicians and practitioners, is one of the main goals of the society. So we need to improve the number of events, the schools, which are very important initiatives that the society has entertained in the past few years. These are events where the people get information from big experts and on a practical standpoint. And on the other side, all the digital education needs to be increased and improved and broadened in scope. And this has a very practical utility for the person, because to have access to the information without having to move from your home or your office is an incredible advantage, and it's really cost effective. So this is one of the main reasons why people should consider becoming members of EMAS. And then EMAS has devoted a lot of time to promoting junior membership, both helping junior people to access the society as members, with very, very low and dedicated economical offers in terms of membership, with the full advantages of being a member, but mostly helping them creating a whole program, the Junior Mentorship Program, which helps them get in contact with major experts in the field to be helped with their early stages in career, in thinking and planning research, writing papers, finding good occasions, good chances to get, for instance, PhD positions or promotions. This is all very important, and we need to continue pursue this and to get it to the next level, where this will really become a big service for our junior membership, that is to the future of the field. So I really look forward to the next 2 years of my presidency term in order to try and build up on this incredibly exciting position the society has reached, and to make again another major event, which will be in Berlin, where everybody is invited to come, which will probably set the scene for the next international level of the European Menopause and Andropause Society.
Well, I'm very happy to be here for several reasons. Number one, because the Congress, the first Congress of this association took place in Portugal. Second reason why I'm very happy, it's because I was one of the founders of EMAS. Third reason, because I'm very proud to have been elected as honorary member of this association. And the fourth reason, because I see that more and more younger people are coming to this Congress, and not only the dinosaurs, but the younger people are producing very important data, and this means that philosophy will continue. Of course, talking about the menopause, we should talk instead about the climateria. That would be more correct. Is a problem that has been for a long time in the hands of the pharmaceutical industry. As a matter of fact, it all started with a project from the distinguished Organon company, because they wanted to sell products for the menopause. So the best idea would be to organize international meetings to create a space for drainage of that product. But later on, this gave rise to the International Menopause Society and then to the European Menopause and Andropause Society. Today, I feel that the scientific level of the presentations of this meeting is very high. And one point to mention is that for the first time, I see sessions devoted to discussion of clinical cases. And this is not only very interesting, but very important, because a scientist, when he delivers a lecture, he says what he wants and is protected by himself. But when he's confronted with a discussion of a clinical case, he has to show himself without protection and be exposed to confrontation of other opinions. So I think this is extremely interesting and very productive. So for all these reasons, I'm very happy. Besides, another reason that I have lived in this country, in the Netherlands, for 5 years. And so it looks like being home again, not only because of the MS, but also because of the country.
This is the first time for me to come to EMAS. I have attended many menopausal societies meetings before, mainly in the UK where I work, and I decided to come this time because it's a very good combination, having the Menopause Society, Andropause sort of combination to it. It's really quite nice, and I've learned a lot in the last day or two. I think it is having the European flavor to the whole thing is fantastic, because you have people from Italy, Spain, Germany, Switzerland, Poland. So it's really nice to see other people's practices and to see how can I benefit from that to take it back to the UK. I hope I will be able to attend many of more of these meetings, work permitting, but I think the next one is going to be in Berlin, so I think I look forward sort of to finding the time to go and attend this, and hopefully I will learn even more than what I've learned in the last few days.
I think that that mentoring program is very interesting, because it's a way in which we may have new people coming into the society, and also the possibility of twinning between centers, because those are people, they are graduates coming from centers that move to a different center or that connect with a professor in a different center to develop a program of research. So I think that's something which enriches the society a lot, and that will create a wave of new professionals with a very good, excellent background.
I think that webinar is a great development of EMAS, European Menopause and Andropause Society, in the field of menopause and andropause. I had the pleasure to present in April the webinar on eating disorder in older women, and it's very good idea that people all over the world could join it as a lifetime and even later watch, because it is registered. And in my opinion it's also very clinical and good for scientific and clinical development of young doctors, in this case in the field of menopause and andropause.
I was very happy to be a speaker in the webinar organized by the European Menopause and Andropause Society. I think the webinars are an example of education for the young people, an easy target for them to stay at home and be a part of an educational program with experts in the field and on specific subjects. Menopause is well known to be a part of human life, as pregnancy is a part of the normality, and that's why at least in my webinar, I've tried to explain this and to communicate the actuality and all the data we have in 2070 about the normality of the menopause in a woman's life. It was a good experience, and in my webinar as a speaker, and then as a participant at the other speakers' webinars. I enjoy the possibility to talk with them, to ask questions, and also my students and my residents from the department who participated freely as junior members and having a trial of membership. They were actually very happy to get the novelties in this field, and they felt close to the society, to the European society, and actually to the world of knowledge in the medical field.
Okay, so I'm really delighted to have been at EMAS again for a second time. As someone who's not a gynaecologist, I always feel I have a really warm welcome, and it's great to see musculoskeletal health and arthritis on the agenda and hear people talking about osteoarthritis. It's been a really important area of discussion in terms of gender health, and I think this meeting's a fantastic way of bringing lots of disciplines together to talk about health in the menopause.
So yesterday we had a very good session on the German-Swiss topics. It was a society meeting and it was extremely well attended, and I'm very thankful to EMAS that they arranged a very good slot for us. It was a topic on cancer, so it's very important for all of us, and I think it's always very challenging to have different societies. It was different countries and different people coming from different other places, which will give input how to deal with this very important topic. And I think if you look at the questions what patients do have, then mostly they're very worried about cancer, generally about breast cancer. So we had the different new drugs about the treatment of cancer, and it was a very lively discussion, and I very much hope that the future EMAS meetings will be able to allocate us also a German-Swiss meeting and thereby attract a lot of people for that interesting topic.
So you asked me to tell the reason why I am here. Well, I'm mainly working in infertility treatment business, but it is our interest to do a lot of investigation into preventive management of infertility. So we are very interested in how can we predict an individual's age at menopause, because if we could do that, then we could warn some women way in advance to be careful with their family planning. So this is the main purpose for me to get here, to give my speech and to have my PhD students to give their speeches. And at the same time, there's a lot of things going on here that are of my interest, like hormonal treatment of menopausal symptoms. So I really enjoy this meeting because it, apart from my own topic, it gives a lot of interesting new fields, or other fields that I don't do on a regular basis.
Well, this Congress has been a very nice opportunity to meet a lot of people, experts on the area of gynecology, oncology. Well, you know, the second half of the life of the women and men is related with several types of cancer, and we need to improve prevention of cancer. So we have the opportunity to discuss with several colleagues actualization, new information about what to do and how to do these kind of approaches in women, of course also in men, but I'm, as a gynecologist, I'm very interested in women's health. So the level of the scientific presentation has been very high. The opportunity to discuss directly with the speaker is very important because sometimes we need to ask for detail. This is an opportunity to fix for those who are working in special areas of oncology, gynecological oncology. So I encourage people, young people, to come to this Congress, to this society. The society is very open, and we discuss in a multidisciplinary focus. We put emphasis in different specialties, and the head of the problem is always either men or women who is in the second half of life, when the pathology, morbidity, comorbidity is so important to maintain quality of life. Quality of life is a kind of evaluation, self-evaluation. How do we feel in our goal, in our media? So it's important both the organic part and also some psychological, subjective evaluation. And this society covers all these aspects, always on the second half of life of both men and women.
So why was I keen to be involved in the EMAS conference here in Amsterdam? I think the most important reason, next to knowing many of the people, and it's always a joy to spend time with your peers and friends, but also I think something very interesting is happening now. We are witnessing this. Reproductive medicine is a very, very broad area that relates to contraception, it relates to infertility. Infertility is very much dominated by IVF. Now slowly the whole early pregnancies and its complications and implications are entering the field, but also ovarian aging and menopause. And that's why EMAS is important in this respect. What happened in the recent past, that all these societies and all these experts, they developed their own field, but they did it in separation, in splendid isolation, if you wish. And what you now see, and I think finally, and I think that's great, that it's coming together again. So in this particular symposium where I was lecturing, the topic was polycystic ovary syndrome, a complex but very common disease, PCOS. And even myself, when I look at my own history as a clinical investigator, the focus has been almost exclusively on aspect of infertility and irregular bleeding. Again, this is one of these. But now, when we go into aging and menopause, we know that long-term health and quality of life is affected by this condition as well. And that has been the topic covered in the EMAS conference.
Of course, it's a great platform for all European countries to get to know more about women's health. So I think it's an excellent platform in general, and specifically the location Amsterdam was wonderful.
Okay, and did you have some new insights, or did you learn a lot?
Yes, I learned more about intercultural differences in menopausal symptoms and new kind of treatments which may be available sooner or later.
Okay, and what do you think of the organization?
The organization for the EMAS conference.
Yeah, how it's organized here?
Very good, very good. So it's the location is great. It's very easily accessible from everywhere, and I think everyone is very friendly, and so it was a great pleasure to be here.
This is a fantastic meeting. There are a lot of distinguished scientists, and also there are a lot of people. So it's a very up-to-date information about us, about physicians and everything. And there are new technologies that we are not aware of them, such as laser. Also there are new concepts about hormonal therapy in menopause. So this is a fantastic meeting at all.
Okay. And what about the organization?
The organization is, again, let me say, fabulous. I mean, everything's in time. So it's great.
Okay.
Could you give just a small word about the association?
Actually, I am a member. I am an old member, probably more than 15 years of EMAS, and EMAS is getting, growing very fine. And it's in the olden days it was a small group. Nowadays it's getting larger and larger. The meetings are more successful. So it's okay. There are also on the website webinars and everything. So they are using the technology. So it's excellent.